Penn Medicine has signed a letter of intent to buy the Brandywine Hospital located off Reeceville Road and the 30 bypass in Coatesville. And this hospital, it's been closed for 18 months. And to me, this is a huge piece of news for the Coatesville community, for people that live in western Chester County and in Berks and Lancaster County, simply because of the stress the other hospitals in the area, specifically Mainline Health in Paoli and the Chester County Hospital operated by University of Pennsylvania in Westchester, have been experiencing. This hospital has almost 200 beds, and there's nowhere to go if you get sick, right? There's an emergency that happens, you're out that way. You're talking about a 30 to 40 minute commute to the closest hospital. This is just good for the local community, number one. And secondly, it's gonna bring a ton of jobs to western Chester County. So this is really great news there. We're talking about potentially 800 jobs that could come from this hospital, again, being in operation and being a place for care for local residents in western Chester County. So let me give you some quotes from this, but this is really big news here. So Sue Parati, the president and CEO of Tower Health, that's who owned the hospital before the letter of intent, or still owns it actually in this case, since the letter of intent has been signed, they actually had to call off a prior sale. And they told employees in an email that Penn Medicine's buying it, which is great news, and they expect the transaction to be completed by the end of 2023. And because of the folks that have secured the facilities during those past 18 months, this is a really positive outcome because of just the jobs coming to the area, especially with the need of having care facilities in a growing area like western Chester County. I mean, you're out in western Downingtown, Coatesville, Elverson, those places. This is going to be your closest hospital. And Penn Medicine, they obviously provide top health care, are very well renowned. They haven't made a comment yet. They haven't returned any comments on this. But I see a couple really important outcomes. It's an 85-acre campus. Nowhere is it good that something on 85 acres sits vacant. That is not good for the community. That's not good for the neighborhood. It's not good for Chester County or Coatesville. So first and foremost, having this occupied and being functional is a big boon for the local residents. So this is great news there. They have a place to go for emergencies, to have their doctors housed. There's going to be better health care. And we're very fortunate in this area to have a lot of great hospitals. To have them locally is even better when it doesn't take you a long time to get there. And again, there was a lot of stress on Chester County Hospital in Westchester and Mainline Health in Paoli. And this isn't the only closure. The hospital in Jennersville also closed, which is more southern Chester County. So now we've got another hospital that's going to help support those folks as well. And because there's rumors that there may be a partnership with the Coatesville VA. And I don't know if you've ever been to a VA hospital. I volunteered at a VA hospital when I was in college. And those places could use a strategic partnership with a company and a healthcare system like Penn Medicine. VA hospitals rely on government funding. It's not quite the same as your normal hospital or healthcare facility. So if there's rumors of this partnership and that comes to fruition, this could be great news for what's going to happen to the local community in Coatesville, in Chester County. So you got more jobs, and the hospital's in a super convenient location. That's another big boon here. It's right off the 30 bypass in Reeceville Road. So to me, this is nothing but good news here for the Coatesville area, Chester County, and for the folks that need doctors and health care. It's going to bring jobs. It's going to bring more economy there. Maybe we'll see some development happen down the line. If you look at what happens around other hospitals, there's constantly commercial development around them or residential development. And for this place not to be vacant anymore and now to be occupied by Penn Medicine, this is a major win for the local community.